Good afternoon, MPS management team members. Hey, thank you for taking a couple of minutes to join me for this recording today. My name is John Claudio Plonzo. I am your employee benefits consultant. I have been working with your organization's leaders to look at different options that we could put together for all of our combined companies. So yes, this presentation is titled MPS Management, but you very well may work for one of the other entities within our group, so please know this does apply to you. This presentation, please guys, is for our Colorado employees only. So if you are listening to this presentation and you are not in the state of Colorado, please refer to our out-of-state presentation link that was sent out to your general manager. So once again, my name is John Claudio Plonzo. I wanted to take a couple of minutes with you to help you understand the different plans that we're offering and to guide you as much as possible. I know that these medical plans and such can be a bit confusing, so we tried to help you be good consumers of your health care with as much education as possible. So with that, let's jump right in, and we'll try to keep this presentation as quick as possible. All right, guys, so great news. As you may have heard through our company memos, we are partnering with Anthem of Colorado, which is a subsidiary of Blue Cross and Blue Shield, which is phenomenal, everybody. I do want you to know that I work with all companies. I work with Aetna, Humana, Cigna, and in my personal opinion, Blue Cross Blue Shield and the way that they run their operations is my favorite carrier in the entire country. So I'm very happy for you guys on that front. They do a great job with their network, and they do a great job with their coverage. And, of course, also, which was important, was their pricing. So they did come in the most competitive for us as an organization. So with that, everybody, on the screen, you can see you have several options to choose from. On this page, I do want you to know that these are HMO plans that you can select from, okay? Now, an HMO, guys, all that really is saying is that we have to actually stay in network, okay? So these particular plans, there is a network of contracted doctors and hospitals that will accept these three plans. HMOs are the way of healthcare today, okay? So don't let that deter you in your decision. We have really good networks in network, and I really think that you'll have no issue finding your doctors and hospitals in network. But do know that we have 3 HMO options, and we have some PPO options we're going to talk about as well, and I'll explain the differences. So again, these HMOs are only available to our Colorado employees, everybody. So please be sure that if you're on this call that you are in Colorado. These networks only work in Colorado, all righty? Okay, so our first plan, everybody, so what we were trying to do for you as an organization is to give you a low, medium, and high option as far as the different plans you can choose from. This first plan, everybody, is a health savings account plan, okay? Now, for a lot of you, I will share I have a plan like this for me and my family, okay? And the reason that I choose a plan like this for me and my family is because, yes, for the most part, we are fairly healthy, okay? And so we don't have a lot of needs throughout the year, or we don't have a lot of predictable needs, right? For the most part, we're fairly healthy, and we predict that we're not going to need that much health care. So this type of plan is really designed for someone that is comfortable with not really having co-pays for services, okay? We're going to talk about this. As you can see, as you start to look through the plan, everything on the plan is subject to the deductible plus 30%, okay? Now, I know that sounds a little scary, but don't let that intimidate you. I'm going to teach you why even having a plan like this is really critical to protecting you and your family, okay? Again, remember, I have a plan like this. But the real special thing about an HSA plan is that you can actually participate in a health savings account in addition to the medical plan. And the reason that you might do that is like we mentioned, everything is subject to the deductible on this plan. So you can put money away on a pre-tax basis into a health savings account, and that can be your choosing, okay? You can go right to your bank, whoever you bank with, and ask to start an HSA if you would like. And you can put money in that account, and that money, you never lose it, okay? So I know some of you might be thinking about flexible spending accounts. Flexible spending accounts, yes. Once you put the money in, you have to use it by the end of the year. But in HSA, guys, you do not have to do that. It's your money forever, and anyone in your family can use that money in the HSA, okay? The spirit of this, again, so why do I choose a plan like this? Well, guys, I'm trying to get my family premiums down as low as possible. Health insurance is really expensive, right? And that's just kind of the crisis in our country, is that we have really high health insurance costs. So because of what I mentioned, for the most part, me and my family are healthy. I'm willing to, what I'm trying to do is keep my premiums down as much as possible for me and my family. Remember, I have to insure my spouse, and I have 3 children, okay? And so that's why I choose a plan like this, because I can keep my monthly my expenses as low as possible, and I can put a little bit away in my health savings account as well, okay? So let's talk about why you would do all that. All right, so you can see that on this plan, we do have a $4,000 deductible, okay? So you do have to kind of think about that, right? Even if I go to the doctor or if I need to go see a specialist, I do have to pay the deductible first and then 30%. So what I do want you to know about this, though, is that you are getting the Blue Cross Blue Shield negotiated pricing for these office visits, okay? So it's really important for you to know, because you guys know if you go to the hospital or you go to a doctor's office without insurance, you're paying full price. And I'm sure some of you who have ever gone to the hospital without insurance, you know how financially painful that is. You are not protected by a big carrier like Anthem to help you get negotiated pricing with the hospital. But just being a member, you are going to get the negotiated pricing for any services. Now, normally, a primary care physician office visit might be $120, but with your Blue Cross discount, it's probably going to be $60. Many times it's half of what the full price is. So in my example, let's say you go to the doctor, you're not feeling well. Just an example, guys, it'll probably be around $60, okay? That $60 is going to go towards your deductible, okay? And that's kind of how this plan works, is that everything on the plan is subject to the deductible, but you do get the negotiated price. Now, one really important thing is that preventive care on any of our plans costs you nothing. So gentlemen on the call, our annual physicals every year, and guys, you got to go do that. It's really important to go get your annual physical every single year. I have so many stories of people that have caught heart disease, cancer, diabetes. They have caught those things early because they went to their physical and were able to get those things under control until they became a problem. And guys, in many of my stories, almost lethal. I recently had a gentleman who had no idea he had 97% blockage in his heart, and he went to get his physical, got some blood tests, and they discovered he felt absolutely fine, but he had no idea that he could potentially have a heart attack at any moment. So just to give you an example, a true story that just happened. So make sure, guys, the reason that this is this way, that it is no cost to you, is we want to encourage you to go, okay? We want you to go get your physical. It's zero cost to you. Your insurance will pay for it, and the whole point is to make sure you're healthy. Ladies on the call, same thing. Your Well Woman's exams covered 100%. And for those of you, and of course your routine mammograms, colonoscopies at a certain age are all covered at 100%. And then for those of you who put your children on the plan, all of their well child exams, immunizations, all covered 100% on any of our plans, okay? So you see why that kind of works for me too, right? We're fairly healthy in my house, and luckily all the preventive care is covered. And I really only have to worry about out-of-pocket expenses if the kids get sick and have to go to the doctor, or if we need to go see a specialist, for example. And then, of course, heaven forbid, if we have to go to the hospital, right? So let's talk about that. Okay, so number one reason to buy health insurance, guys, is the network discount, okay? Having the power of an insurance company helping you negotiate with doctors and hospitals. Number two, most important number on this piece of paper is your max out-of-pocket, okay? So what happens here, heaven forbid I have to go to the hospital, right? I have to go to the hospital here, and I'm in the hospital for, I don't know, a week, 2 weeks, heaven forbid, okay? Yes, I have to pay my deductible, okay? I have to pay my deductible, yes, $4,000, and then I have to pay 30% of the bill after that. Now, some of you may be thinking, well, gosh, John Claudio, 30%, that's a lot of money if I'm in the hospital for a month. What's the point of having insurance? Well, guys, this is the point of having insurance, is the max out-of-pocket. My maximum exposure for employee only, if I'm on this HSA plan as employee only, my worst case scenario is $5,500. You see that? And so that's really why you buy insurance, guys, is to protect you from really catastrophic health care needs that you might have. And so you're protected by this max out-of-pocket. And, hey, I know $5,500 is a lot of money, everybody, of course, but you can make payments on that, If you have $1 million hospital bill, that's going to be really tough to manage for the rest of your life. I think you would agree, right? So that is another reason why to have health insurance is the protection of your max out-of-pocket. Okay? All right, so the HSA plan, major difference, everything is subject to the deductible, including prescriptions, doctor's office visits, labs, x-rays, anything that you need, okay? It is subject to the deductible first. And the whole spirit of that is that you can participate in a health savings account to help with those expenses should you have them, all right? Now, one thing I do want you to know, there is a family deductible and a family max out-of-pocket, so you got to watch out for that as well. As a family, you could potentially hit $8,000 in deductible and $11,000 max out-of-pocket. Okay, guys? All right, so that's kind of how an HSA plan works, and let's move on to some of our copay plans, which are a little bit different. So this is kind of our bronze plan, okay, our HSA bronze plan, and then we also have a silver plan and a gold plan for you to choose from, okay? And these higher metal plans, what we have done by design is to give you a traditional medical plan setup. Now, this looks a little bit different, right? Notice that now you have copays for different services, okay? So on this plan, if you decide to elect our silver plan, now you don't have to worry about the deductible for everything. The deductible is waived for prescriptions, so you get copays for prescriptions, and you get copays for doctor's office visits, and you also have a virtual visit that you can take advantage of too. You can see a doctor over your phone for a copay as well. The other thing, we still have our preventive, right? We talked about that. And you do still have and you also have a copay for urgent care. So let's say it's a Saturday and you're not feeling well, you can go to a walk-in clinic for a copay of $60. Okay, so on this plan, you do have some copays that make it a little bit easier to use some of the services rather than having to worry about the deductible for everything. Now, on other items like diagnostic lab work or x-rays and so on and so forth, hospitalization, of course, right? We do still have to meet the deductible until we reach the max out-of-pocket. Right? So that still stays the same. For all the services that I've outlined here that are subject to deductible and coinsurance, 30%, you do still have to follow the pathway that we talked about, like on the HSA plan. $5,000, 30%, until I reach $7,000 max out of pocket. Okay? So the difference here is that you do have some things that are easier to use, like doctor's office visits and prescriptions, whereas on the HSA plan, they're subject to the deductible, okay? And then really from there, guys, the plans operate the same. It's really you deciding what deductible you're comfortable with and copays that you're comfortable with, et cetera. And you can see they're very similar with these other plans. Now, our gold plan, you'll notice, also covers blood work, diagnostic blood work, and x-rays, and it also has an emergency room copay. So on this plan, if you do go to the ER, you do not have to worry about the deductible. You only have a $400 copay to go to the emergency room. Whereas our other plans, you can see you do have to meet the deductible even in the emergency room. So those are some major differences between the plans, and you can decide whichever one of these plans you would like to enroll in, you can. Okay. Now, we had one good question come up. Well, John Claudio, if I want to enroll my children only, can I do that? Well, guys, you have to take the plan yourself first, okay? So you have to take employee only, and then you can certainly add your spouse and children or your entire family to the plan that you've chosen. The access point is you, okay? So just so that you know, that's come up a couple of times. I wanted to make sure to outline that. And here at the bottom, everybody, I wanted to make sure you saw this. So we have some of our facilities pay weekly. So these are the weekly numbers, okay? This will come out of your check 52 times a year, these numbers here, okay? And then we also have some locations that we pay biweekly. So make sure you know which frequency you're paid at your facility, and these are the costs based on your frequency. Now, I do want you to know that these costs are after your employer is going to be covering half of your employee-only premiums. So I want you to think about that. That's quite a big benefit that the company is providing you. They are going to be covering half of your employee costs at the employee-only level. So keep that in mind as you look at these figures. These are after the company is helping you to achieve these costs, okay? So, for example, if you want to take the HSA plan, employee-only, and I get paid weekly, then that means that $38.55 is going to come out of my check on a weekly basis. Now, guys, I know you're all looking at this preliminary rates, okay? I do have to let you know that we are launching as a new group right now, and so we do need to see what the final rates will be. I don't think it'll be an issue, but I do need to let you know that these right now, as you know, you completed a survey that we had requested asking if you'd be interested in the health insurance. And so that's how we've come to these rates, and I think it'll be okay. And if there's any changes, we certainly will let you know, and you can certainly make any changes that you want after everything settles down with the final rates. Okay. All right, let's go to page 2 really quick. So page 2, everybody, this is where our PPO plans are located, okay? Now, the big difference with the PPO is that this network is a little bit bigger than the HMO network, and you can go out of network if you absolutely need to, okay? Now, I do not recommend it, okay, because when you go out of network, the deductible is quite high, all right? So you always want to do a really good job of staying in network whenever possible. You certainly can go out of network. You have some help there, but you do have to pay the first $10,000, and then Blue Cross will help you pay half until you reach $12,700, again, max out of pocket, out of network. Now, I do have to let you know, doctors out of network are not contracted by any pricing, okay? Remember, in network, they're contracted. You're getting that discount for going to that doctor in network. But when you go out of network, they're not contracted. So they can ask you, they can balance bill you, okay? Even though Blue Cross paid half, they can say, well, I charge more than what Blue Cross pays, and you could be balance billed for that. So keep that in mind. But we have 2 plans on the PPO network that you can choose from. And, of course, this is also an HSA, so same thing that we talked about. You can participate in a health savings account. The deductible is a little bit higher on this plan, $6,350, but that matches the max out of pocket. So once you pay your deductible, you pay $0 after that. This is what we call a 100% plan. Once you meet the deductible, the plan pays 100% after you meet the deductible. Again, that is in network, okay? So that's everything in network. If you go out of network, it's a different, as we talked about, it's an out-of-network benefit when you go out of network, okay? All right, and then our silver plan for our PPOs is also here and very similar to our HMO. We have a $5,000 deductible, $7,000 max out of pocket, and then we still have our copays for prescriptions, doctor's office visits, our free preventive, which is the same on the HSA, and then our urgent care copay. You are able to go out of network on the copay plan again, but same thing applies, right? If you go out of network, you have to pay the out of network deductible and max out of pocket. If you stay in network, you receive the in network deductible and max out of pocket. And once again, weekly numbers are here at the bottom. Bi-weekly, depending on your how you're paid, you can see the cost for these plans for employee only, for your spouse, children, and family as well. All right. Okay, one thing, I did want to show you guys this neat diagram. I thought this was a great visual of how the deductible works. So this is how it works, right? Right in here, you're paying your deductible for those items that are subject to the deductible. Don't forget, if you pick a copay plan, you don't have to meet the deductible if you have a copay, all right? But pay the deductible. Once you pay the deductible, then you start to share in the cost with Blue Cross. You pay a little bit, 30%, and Blue Cross pays 70% until you reach the max out of pocket. And once you hit the max out of pocket, you can see only Blue Cross starts paying. So once you hit the max out of pocket, Blue Cross Blue Shield pays 100% of your medical expenses. So once again, that's why it's so important to have health insurance. And then there was another great diagram here that I thought would be good for you guys to see. Prescriptions, guys, so we'll go back to this, but you can see there's different tiers for prescriptions. So you guys know this, generic medications are the most inexpensive. And for many of you, you can go to Walmart, for example, and there's a lot of generic medications at Walmart for $4. Take advantage of that if your medication is available in generic. Now, for some of us, of course, there might be a brand name medication that you need, and it's not available in generic. That's okay. That's why you have health insurance, okay? Those do cost a little bit more, and the copays are a little bit higher, but I did want to show you this is how pharmacy coverage is structured. So let's come back to this really quick. So you can see on our copay plan, for example, let's go back to our HMO. Let's go back to our HMO really quick, okay? Our copay plan has copays for prescriptions. So again, it's $15 for a generic, or it's $50 or $70 for a brand name medication. Now on this plan, there is a $200 deductible for brand name. But notice on our HMO, on our middle plan, there is no deductible for the copays for prescriptions. So again, this is generic, and brand name medications can be either $50 or $70 for brand. So that's what that tiering was referring to. Okay, while I have you, I thought it'd be really good to show you how to look up doctors. This is a really good habit to get into, okay? The website is www.anthem.com, and what you want to do here is you want to come to individuals and families, find a doctor, okay? This is a really good habit. And guys, once you get your ID cards, I really encourage you to register and get into the habit of logging into your portal, because you can see your claims, you can make sure things are correct. It's a really good habit to get into. All right, down here, you're going to search as a guest until your ID card comes, or once you enroll, you can log right in and it'll pick your network for you. But for now, searching as a guest, you'll search by selecting a plan or network. Okay. Here, we're going to be looking for medical doctors. So once again, guys, our medical is with Blue Cross Blue Shield, and our dental and vision is going to be with Mutual of Omaha, and I'm going to show you how to do that. For this example, we'll pick Colorado, and depending on the plan you choose, our HMO is here, HMO, right under this medical network. You want to pick HMO, or if you're going to choose a PPO, you want to choose Anthem PPO. But for this, I'll choose the HMO, for example. And then here you can search by facility. So I'm going to look up doctors, family general practice, just for an example. And one way you can do this is just to put your county and state. Okay, so in Alamosa County, Colorado, 20 miles, I'll click search, and it'll bring up all of the participating doctors within 20 miles that accept the HMO plan. So you can quickly look up by name or look up by doctor type, and you can see if the doctor you would like to see is in network in the HMO. Now let's say you want to just kind of check, right? I'll show you this trick. Once you get into a doctor, here's Dr. Svetlana, okay? You can see all the insurance plan that this doctor accepts. So this doctor actually takes both the HMO that we're looking at, and they also accept the PPO. So that's a quick way of looking and seeing all the plans that a doctor accepts. Okay, I wanted to show you that really quick. All right, let's keep moving here, and we'll move on to dental. So we also are offering dental and vision options to you. These are completely voluntary, so it's up to you if you would like to participate in this. This is a national PPO dental plan, so you can use this plan across the country. You can go in network or out of network. And hey, just like the medical, I definitely recommend that you stay in network, right? If you stay in network, again, that dentist is contracted to give you significant discounts with the insurance company. So the way this works, very easy. For your preventive care like cleanings, it's covered at 100%. Okay, so your routine cleanings and x-rays, you will pay 0. For basic services like fillings, for example, you'll pay 80% of the cost. And for any major services, you'll pay 50% of the cost. Now, for basic and major services, you do have a $50 deductible. So just to let you know, there is a $50 deductible. And the plan will pay up to $1,500 a year. So, and that's per person. So if you enroll yourself and your spouse, then both you receive $1,500 in benefits, and so does your spouse. Okay, and if you enroll the children, each of your children gets $1,500 in benefits as well. And so here are the costs, again, weekly and biweekly, okay? It's $8 a check for weekly, $16 a check biweekly if you would like to participate in the dental plan. Now, let's say your dentist is not in network, then you can go out of network, okay? And I know I've been teaching you guys, hey, be sure to go in network whenever possible, but I will tell you, my dentist is out of network. I love my dentist. I don't want to change. And so I do go out of network. So you may be balance billed for a little bit extra from what the insurance will pay, but it follows the same schedule. They'll pay 100% of preventive, what's reasonable and customary. Again, your dentist might balance bill you a little bit more, but it covers 80% and 50% just like we talked about. Okay, so you can definitely choose the dental plan if you would like. You can mix and match. So if you want to buy employee-only medical, but you would like to buy employee children dental, you can do that. Okay, so you can mix and match however you would like between the three. Lastly, we also have vision coverage that we're offering. And I will say that if any of you wear glasses or contact lenses, I think this is a great deal. You, again, if you stay in network, you get your exam for $10. And this is the best part. You get $150 to spend on contact lenses or glasses, whichever you prefer. And even if you go over $150, you get a 20% discount over the $150. So in my opinion, guys, for the premiums, it pays for itself. It's a good deal if you wear glasses or contact lenses. If you have good vision, then you really do not need the vision plan. The primary purpose of this plan is to help you with the expense of glasses, the exam, and contact lenses, okay? So you can see your exam's $10 like we talked about, and then you can get your single, bifocal, or trifocal lenses for a $25 copay. And then again, you get that $150 to help you with contact lenses or frames. You can get your exam once every 12 months, your frames once every 24 months, and your lenses once every 12 months, or your contact lenses once every 12 months. This works on a rolling 12-month calendar, okay? So keep in mind that if you use the plan in July, your 12 months will be the following July, okay? But I'll show you how to look up doctors and doctors for both the dental and vision really quick. Let's jump to that. Okay, so the website is Mutual of Omaha /dental. It will bring you here to this website, and then here you're going to click on Visit the Member Portal. Okay? And once you get here, it's really easy. You just put in your zip code, and you can find all the participating dentists on the dental plan. Okay, it lists them all here. If the dentist you'd like to see appears, then they are participating dentists. Same with the vision, mutualofomaha.com /vision. And okay, and here you're going to click on View My Vision Benefits. And down at the bottom, you can do a provider locator search here. And again, once again, very easy. Put in your zip code, and you can find all the participating vision providers in your area. So like Rocky Mountain Eye Center, ABBA Eye Care, these are all participating facilities for the vision. So very easy to find participating providers. Now, I do want to tell you, don't forget, okay, that you can go in and out of network on both the dental and vision. So if you do want to go out of network, you can on the vision, but just know they're only going to reimburse these certain amounts. So they'll pay up to $37 for an exam. They'll pay up to $20 for single vision lenses. So it works a little bit differently if you go out of network. Again, I do encourage you to go in network if you can. All right, the rest of this kit, everybody, has all of the details of the plans from the dental plan to the vision. Okay, that is all in here for you. Also, all of the information on the medical, the detailed medical plans are all in this kit as well. So if you do want to look up anything in greater detail than what I've provided on the first pages, it is all here for you. And at the very end, everybody, is my information and your account manager, Jackie. Okay. So if you do have any questions, please do not hesitate to contact us. We can certainly help you with any questions that you have. All right. Now, homework. Now, what do you need to do to be able to enroll? Well, as part of your kit, you receive this enrollment form, okay? Now, every full-time employee of the company must complete the enrollment form. The enrollment form acts as both a way for you to get coverage, and also for those of you who wish to waive coverage, this is the document that you will do that, okay? So if you would please fill in as much as you can, as legibly as you can. We are going to use this to actually put your information into the Blue Cross and Mutual of Omaha system. So please, guys, take the time to write legibly, okay? Down here in part 2, you're going to let me know any of your family members that you would like to enroll. So again, you can mix and match however you'd like. So let's say you want to take employee-only medical, that's okay. But then you want to put your spouse on the dental, so you're going to do employee and dental for my spouse. But then let's say for the kids, you want everybody to have vision. Well, they can also be on the vision, okay, for family. And so you can go on and check through that just like that. On page 2, you'll see you're going to let me know exactly what you'd like to enroll in. Now, if you're declining coverage, and please, guys, every full-time employee must fill this out. So if you're declining coverage, please let us know. I'd like to decline coverage, or maybe you're declining medical, but you do want to take the dental. That's okay. You can do that, okay? And maybe you want to take the vision. You can do that as well. Just please let me know exactly what you would like to do on this form. It's very important. And if you're waiving coverage, also decline up above, but then also let me know here that, hey, I'm declining medical. I'm enrolling in dental. Oh, excuse me, not that you're declining. Perhaps you're enrolling in medical, you're just declining dental, for example, okay? And then on the last page, you want to sign, okay? So just be sure to sign the very last page, and you'll be done, and date, okay? So this is all we need back, everybody. We are asking that you get this back to us by March 15th, excuse me, I'm sorry, May 15th, everybody. so that we have time to get you installed into the Blue Cross and Mutual of Omaha system. Okay, guys, so just a reminder that our Friday health plans are expiring at the end of May. So if you are enrolled today on the Friday health plans that we are offering today, you do need to take action and fill out the enrollment form to re-enroll in the Blue Cross Blue Shield plan or Mutual of Omaha starting June 1st, okay? So this is all going into effect June 1. All right, folks, that is all that I have for you. I know this ran a little long. If you have any questions, please do not hesitate to contact me. I will put that up on the screen. Okay, so here's my contact information again and Jackie's, and if you have any questions, please do not hesitate to contact us. Thank you again for your time, and I hope you have a great day.